And now, Mona Bormet, who's our project manager for policy and advocacy, and I think probably deserves several other positions as champion, cheerleader, and go-getter for all these activities. And she's going to talk about the advocacy issues.
Okay. Hi, everyone. How are we doing? Are you feeling good? You sat through two presentations. Wiggle around a little bit. It doesn't bother me. Okay. So Lauren spoke about really success stories, about really exciting projects and what's been happening with family planning on the ground, people in faith-based organizations applying family planning methods. And Amy described more about, you know, the supply issue and why it's important for faith-based organizations to work with secular organizations in the supply chain and work on that. And my role at CCIH is to think of a way to take the work that all our faith-based organizations are doing in our CCIH network and bring our voices to people who honestly fund grants, give money, make decisions that affect us on the ground. So when I think of policy and advocacy, from my standpoint, it's a lot of educating people who might not know what faith-based organizations do. And specifically, I'm funded to educate folks based on family planning. I think, I'm not sure for those of you who work or live in other countries, maybe family planning doesn't have as negative of a connotation where you work as it often does in the United States. Family planning here in the US can often be seen in a negative light. And so that's why people are often surprised when I go into an office and I say, faith-based organizations use family planning methods. They do family planning. And I think it's because people don't understand what family planning is. So that's just kind of the context of my work and a lot of what I do on behalf of CCIH and our network. So we have already seen that. So my goals for today are to tell you, so I work in policy and advocacy here in DC primarily, what's going on here in the United States that affects family planning, talk about messages that have worked really effectively, and how we at CCIH take action and how we'd love for you to be involved in taking action with us. So that's where I hope to go today. So this slide can be really confusing, and for those of you who don't understand the policy process, I'm going to try to explain it as simply as possible. So we have a president, and then we have Congress, and Congress has two chambers, a House and a Senate. And each chamber of Congress has to pass what's called an appropriations bill. Appropriations basically means money. So they have to pass a bill about how the US government spends money. So what the left side of the slide shows is the House Money Committee, is what I'm going to call it, passed a bill that cut a lot of funding to global programs. Now, I'm trying to think of a way to describe this that won't make it more confusing. So in the House and the Senate, in the United States, we also have Republicans and Democrats. And in the House, Republicans have control of the committee, and in the Senate, Democrats have control of the committee. And so those political issues also affect often how money is allocated. And that's as far as I'm going to go with that. So on the House, there's been a lot of cut to global health programs. Specifically, we could talk about all the global health programs, but I'm focusing on family planning. That's the number that's been given. On the Senate side, it's a higher number. Both, the Senate number is greater than the president's request for family planning. It's greater than the House bill, and it's greater than fiscal year 2012. Sorry for the acronym. So what's going to happen this year in the US Congress? What's most likely going to happen is these bills are supposed to pass, and then they go to a committee together, and they're supposed to make it one bill that's going to pass, and that's going to be the money. Well, the chances of that happening by when it's supposed to happen, the end of the US government fiscal year, slim to none. So then there's this thing called a lame duck session. So basically, what that means for us as a community is we have until like November, December to keep advocating that we as faith-based organizations believe that funding family planning and reproductive health is important, and that it's not a dirty word, that faith-based organizations do engage in this. So that's the simplest way I can say it. It's a very complicated situation. I could spend an hour talking about just this, but you would be bored and confused, hopefully not. So when I go to the Hill or when I go to other places, CCIH has a common definition. So what most of you have noticed, this morning in our worship service, we have people from all over the world, from all sorts of different denominations, and we could say from all sorts of political areas that are represented in CCIH, from the far, this is your far left, to the far right. And so what CCIH represents is the common ground. So in 2008, CCIH conducted a survey to find out, what do our members think about family planning? And what we found is that they support it, according to this definition. So our definition that we use when we advocate, that's the common ground. So I must say there might be members that are more far left or far right of this definition, but this is the common ground definition. And that family planning is enabling couples to determine the number and the timing of their pregnancies, including the voluntary use of methods for preventing pregnancy, not including abortion, that are harmonious with their values and religious beliefs. So that's our common ground definition. And like I said, other people might be further left or right from that. But when we advocate, that's the definition we use. And the results of this survey are out in the hall on the CCIH table. So now when we talk about messages that really resonate with our members and that we find resonate with Christians around the US around family planning, is these facts. And that's family planning prevents abortion. It protects the health of women by reducing high-risk pregnancies. It protects the health of children and mothers by allowing sufficient time between pregnancies. It enables women to prevent unintended pregnancies, and it enables families to better care for their children. So when we go out and talk, these are the messages, and that's reality. And I think regardless if you call it family planning, if you call it healthy timing and spacing of pregnancies, if you use the words reproductive health, I would think that most of you in the room would agree with these messages, and these are what really resonate with members. And so we've developed materials that support these statements that are also available on the table. So what's the reality? 215 million women want to avoid getting pregnant but have no access to contraception. So here's an example of one of our members from Hope Clinic in Uganda, and this is a quote from a patient. Prayer is a key part of my life. And what I think is interesting towards the end is she says, using these methods to have a manageable family should be the desire of every Christian, because even the Bible urges us to have children we can care for. And they talk about how grateful she is to Hope Clinic for providing those family planning services to her. So I use that as an example of just reality of a woman who wants to plan her family, and having a clinic that can provide those services is very important to her. So we've talked about what's happening in the U.S. global health environment, policy environment, effective messages that we use and that we found, and why take action. So CCIH last year, policy and advocacy was kind of scary to some of our members. Why is CCIH getting involved in this? And so the board came up with a statement of rules that we have to follow as an organization to work on advocacy. And some of those rules are before we sign on to a letter, before we agree on anything, the majority of our board has to approve it. So I say that to reassure you to know that when we are involved in something, it is approved by our board. And I've said this before, it's important for us to represent Christian faith-based organizations often in secular environments, and to really focus on the unique contribution of FBOs in healthcare. So we've developed some resources that will hopefully help you educate your congregations or your organizations or your friends and your family. We have some resources on our website that have 7 days of prayer related to maternal and child health and family planning. We have liturgy resources for sermons. We have inserts you can use for a church bulletin. They're all on our website. On Mother's Day, we had an e-card that went out trying to encourage people to just think about mothers all around the world, and that's also available on our website. And last year at this conference, and this year we're also collecting stories of those of you who work in the field and work on maternal and child health and family planning. And so last year, Paul Kawali from Malawi is one of the folks that gave a great story about the work he's doing with women and children through the Presbyterian Church. And then Joy Mukari, who's here this year from the Christian Health Association of Sudan, also shared her story. So there's 7 stories on our website, and we encourage you to watch those. And if you're willing to share your story of the work you're doing, I would love to interview you this year. Last year we had our advocacy day. This year our advocacy day is tomorrow. I still have spots left if you'd like to join us. How many in the room are you going? Yay, look at that. It's going to be fun. These are pictures from last year. So it was just a really exciting day, and I can't say enough the power of the voice of people who work on the ground on Capitol Hill, talking to people who perhaps have never seen these situations, have never seen what the lack of family planning services and access to hospitals and care actually does on the ground. And so having people that can describe this is really powerful. Another way in which we try to spread the word about what faith-based organizations are doing are through letters to the editor or op-eds. So Amy mentioned that David Olson, one of our board members, wrote an op-ed in Impatient Optimists. Dr. Henry Mosley, also in the room, had a op-ed printed on Mother's Day in the Washington Post. And Dr. Bob Carter, who is a SIM missionary in Kenya, put an op-ed in the Huffington Post on his work in HIV. And so these are just ways, and we'd love to partner with your organization to highlight the work that you are doing in newspapers around the U.S. and around the world. The ways in which you can connect with us, please, Facebook and Twitter. And how many of you know who you, oh dear Lord, how many of you know who your member of Congress is if you live in the U.S.? Okay, so that means how many of you don't? Okay, some people, there was not the raising of the hand. So I challenge you to visit congress.org. This is your homework. You type in your zip code and it tells you who represents you. And I encourage you to be in contact with him or her. And if you don't know what that looks like, that's what I'm here for, to help you with that. So thank you. I am done. Does anyone have questions?